Welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Los.
Morning, John.
Good morning, Otto. And we had a great conversation with Lisa Stern and Sarah Sampson. Lisa from Family and Children's Association and Sarah from the Safe Center. And we only touched the top of the iceberg, whatever the expression is.
Yeah, I give tremendous credit to people like both of them and anybody else who's involved with that. It's a very, very difficult subject. It's a difficult area. There are people living a terrible, miserable life, locked up with abuse going on around them every day, all day. I just can't imagine living like that. It'd be probably worse than being in jail, to be blunt about it.
Yeah, no, I agree with you 100%. And if you were in jail, you wouldn't be lucky enough to be listening to the Kristina Lu show.
That's true.
So, I mean, come on. That in itself would be just terrible. Good morning, Kristina. How are you?
How are you guys doing?
Very good. Very good.
That was quite the topic. It's never easy. We've done these chats, numerous times, even programs through Project Independence. And it is a very difficult, complex topic, and I was just thinking through Project Independence. I mean, there has been a lot of times that either a neighbor has called or a family member has called suspecting some kind of elder abuse going on in the home, and it's when you hear these, they will rip your heart out, and this social worker on the Project Independence end will, facilitate the APS process and whatnot and kind of follow up on that. It's just, but it does get very complicated, and I think you guys brought up valid questions, because you don't think of all these things certain times, like in a perfect world, everyone would be like, well, why are you sitting there, staying there? Like, report it, walk away, and it's so, there's such a host of issues, in these situations. And unfortunately, we see it a lot in Project Independence. So it's just amazing. There's organizations like this out there, though, that really are clued in and knowledgeable and know how to kind of ease the horrible process for people.
You know what's even, I was just going to say more better, but that's really not a very grammatically correct thing, is Project Independence itself. Mm-hmm. I mean, Otto, thank you for bringing up 311 before, because it's so true. I mean, you have the FCA, you have Safe Center, you have so many different organizations. They're individual organizations. And unless you have a very specific need, you're not even paying attention to the Safe Center. Right.
No, it's hard. And it's, like I said, Family and Children's Project Independence has been partnered with, since our, at the beginning, has been one of our organizations, because they offer such great programs. And, it's what's so important about being on the show, because they have such tailored programs, whether it's scams or financial or Medicare assistance, whatever it might be. So it's so great that all of our staff, our social workers and nurses, have all this information. So they're able to, refer you to that kind of service, which I think is so important, because there is helpful things out there. And that's our whole point. It's hard. I get it as a senior to even begin to know where to look, so the fact that you can call a 311 and be led in that direction is certainly something beneficial.
The way I like to put it in the beginning, when I was first involved with Project Independence, it's like calling 1-800 Independence. If you have any kind of a scenario, you can call, because you have these alliances and these partnerships that the social workers and the nurses are very, very aware of and very up on. And, every situation is different, and they find out what your scenario is and what your needs are, and then they hook you up with it, as opposed to you making 400 phone calls to try to get the right people to talk to. I mean, the concept is great. It really is. You can't cut through all this stuff otherwise.
No, you're so right. And especially in a heavy, stressful situation, like, an elder abuse or suspected elder abuse, whatever it might be, it's you don't even know how to begin, like we were saying, there's so much fear involved and not knowing, what to do or who to call, you have all these different things. So, the idea that you can talk to a social worker and they can kind of just help work, lead you down that path, and I know we touched upon it previously, but I want to remind people, if you need to, because a civilian, a regular person can just call APS themselves, a resident of Nassau County. So if you want to do that, I just want to repeat those numbers, because there's a couple. So if you're calling during daytime hours, you could either call 516-227-8405.
Who is this for? I'm sorry. Who's this
This is
for?
for APS, because
What's
there's
APS?
daytime numbers and nighttime numbers. And I
That's
just wanted
adult,
to,
APS
adult protective services.
Oh, I'm sorry. Thank you. I'm
Yeah.
sorry.
And so you can call that. You could also, and then for night times or weekends, you can call 516-227-8395. So that's nighttime and weekend hours. And obviously you call 311 and we have all this information there too. But
Kristina, I have a question for you. Adult Protective Services, is that a federal program, a New York State program? Would that program exist in every state?
yes, it does exist in every state. Obviously I'm sure it's a little different, but in, this one is the county run. So it's run by counties is how how it's broken down, so there's the big API, and then each, because when I was looking at the numbers, you see in New York State, the website, it has all different, counties in New York State, that will have that. So I assume in other states, they have it kind of run in a similar, fashion, but I know that in New York, that's how it operates.
Well, that would make sense, because if you go into the middle of the country, population in a whole county won't be as much as North Hempstead alone.
Right.
So we have to break it up here. In other places, they probably don't have it broken up that much even. With the millions of people in Nassau County alone, and then Suffolk has to have their own, and Queens has to have their own, and et cetera, et cetera.
Yeah, no, absolutely. It's run by state and local governments. So that's how it kind of works here. So, but yeah, it's really important. And I just want to give a special shout out, because like I said, it's a very heavy topic. But it's great to have these organizations on that really know the information, and, they're constantly, I think it's so wonderful, especially in this current situation we're in, they're always trying to look, on virtual programming, to offer. So, they're really, really wonderful. So great job on that. That was certainly. And speaking of we'll change topics to a more uplifting situation. Since we've been, during this whole pandemic, obviously in addition to listening to us on the radio right now, you could watch it on Zoom, the video, about like a week or so later. It's usually posted on the Project Independence website. So if you were just dying to see, us up close and personal, you can click on that link and see us visually. But it was really wonderful, because I actually got a phone call yesterday from a senior who was watching us on North Hempstead TV, and, was really intrigued by, they were talking about the elder law topic we had on. They wanted his number, and it was just really great.
Oh, good.
So it was just, it just shows you that I think during this time, being able to now have this also, on the radio and, on TV is great. So it opened it up to a bunch of people who might not have realized who the radio show was. She also thought the two of you were lawyers, which I thought was interesting too, but I said, oh, they're wearing a different hat today, the two of them. So, but it was really
take them all out, Otto.
I know. Yeah. You guys are playing all different careers on the show, but
I'll have to put a sign up in front of my house.
That's right. We're gonna have to like really better watch out, Otto. You have to wear a disguise now in public. So, but that was really great. And then next week, I want to remind people, we're going to have another really, really wonderful show. We are going to have on the Honorable Teresa Corrigan, who is a Nassau County supervising judge at the county court and acting Supreme Court justice. So she'll be on, and she's going to talk about the courts and COVID-19, because that certainly has been affected as everything. So we'll learn about that, which I think will be wonderful. So definitely.
Then the following week we're off, right?
Yes, because the following week is the day after Thanksgiving, which I can't believe it's like a whirlwind. I can't even like keep up with, like, time is kind of going actually very, very fast. So that is certainly, but we'll have a special, we'll have repeats on. And then in December, we'll be back with a bunch of new shows. I'm excited. We have great topics coming up. I've been booking January shows as well. So please stay tuned for all of that because it's going to be exciting. We got great topics and we're spreading the word on everything. I just wanted to and I wanted to also just quickly remind people that we have tons of virtual programs through Project Independence. We touched upon it a little last week, but obviously, now there's all different new regulations that came out for Nassau, for New York State. So I know the holidays, it's going to make it a little even more so different for people, what you might have been planning. I think this time it shows you got to be kind of flexible and just follow the rules and be safe. But I really want to encourage people to partake in our special advisory committee that we're going to be doing in November. That's going to be geared towards Thanksgiving. So that is going to be on November 18th. At 11 a.m. It's going to be all of our advisory committees combined. And it's really going to be geared towards discussing Thanksgiving memories and traditions. And if you are interested in sharing something or even showing something visually, you can do that as well. So it's going to be kind of a fun thing. You'll talk about memories, a funny story you might have that happened in Thanksgiving. We all have our different traditions and whatnot. So I think it's definitely going to be difficult for people, during this time to, not get to do the certain traditions that they're used to. But it's nice to talk about it. And I think I'm excited. I'm looking forward to it. I can't wait to hear. And hopefully a lot of people participate and show and tell their stuff. So.
Well, Thanksgiving is still going to be complicated, even worse now.
Yeah.
The last week.
Right. That's what I'm saying. Right. Exactly. Because it's.
Yeah, the COVID experience is getting worse instead of better right now. My family is all up in the air. We're not sure what's going on.
Well, and that's what, is very difficult, because that's what I keep saying to Jay and my family. I said, you kind of have to be in this state of, riding and seeing each day, because each day, frankly, it can change, and you have to be accepting of it. And I totally get, it's hard. Right. It's not easy. The mental component is just as intense as the, fear of actually getting, physically sick from COVID. So it's certainly something that's difficult for a lot of people and change the game. I look at all these people, you make these plans. Oh, I'm going to do it outside. But then, it's like this. So you have to kind of just go with it and trust that it's, for the safety of, everyone kind of getting over this hump together. So all we can do is a virtual thing, and that's what we're going to do through Project Independence. So please call 311 if you are interested in participating, and we'll get you the link to participate. So it should be a nice festive thing. I'll make sure to have a festive background, for this.
We were talking a little bit earlier in reference to you can see these shows on North Hempstead TV. And actually, I was talking to Supervisor Bosworth during the week. And at this point in time, she's probably going to be keeping all the exercise shows on the TV, even when this is all over, because she's getting such compliments that, at 10 o'clock, the karate guy is on or whoever's on. It makes no difference. And it's 2 or 3 times a day. Certain exercise programs are on. And even our particular shows, some of them are definitively dated. But others, like Barry Klitzberg and having Lisa and Sarah on, and different ones. Last week, Marcus O'Toole, they can be repeated too. So there's lots of exciting stuff that's going on North Hempstead TV. But I do want to talk just briefly about, I want to get back to Thanksgiving, but besides that, Otto, you got a program coming up next week in Port Washington, I think it is. Or some
Project Jeff Stone.
Project Help.
Project Help. And it's on Wednesday. It's Zoom. Nancy has the information, Nancy Mizrahi.
Okay.
It's November 18th, 6:30 to 8 p.m. at night. Lisa will be on, the woman who was on before from FCA. And Chief Elder Abuse Unit, Nassau County. There's a lot of people. And the topic is looking at the challenges seniors face today. I am on, frankly, as a Town of North Hempstead resident senior. Uh, and there's a lot of other people who know a lot more about different subjects than I do, but it should be interesting. And
But Otto, you have to understand you're on because if you're putting something together and you ask like Cher to come on, or you ask somebody, a big name, you're the personality. That's why
oh,
you're on.
oh,
It's like, oh, Otto's on.
That's
You
right.
know,
yeah, right. Otto
you're the
who?
draw, Otto. You're the draw. Let's be honest.
Well, it was interesting. I told Jeff, I said, Jeff, I'm a little in overload as it is. And I said, this is a one-shot deal here because he would like to get more people involved, I think, and he's a guy who tries to do a lot of things. And this organization apparently is fairly new. It's like 2 years.
Yeah, we had them on our radio program.
Yeah.
I think shortly before the pandemic. I think, right, John? Remember, it might have been early.
Yeah.
It
The
might have been
beginning of the
early
year.
last year or something. But it's really a great. I saw, that we've been promoting it, it's via Zoom, so you can call 311 and we'd be able to send you over the link and information to be part of that program. So
I mean, the bus, a lot of it has to do with the holidays, COVID, the strife that's caused by just the world around us. Really, I mean, you can't eliminate the election day. For some people, it became a little stressful.
Yeah, of course.
Economic situations, health situations. There's a lot of things, and it really requires strong will, let's put it that way, to not let all that stuff take you over.
No, it's very important because you touched upon it so well, and that's what we always say on this show. Like, listen, I'd love to have a show where we didn't even have to mention, the word pandemic or anything, but unfortunately, that's what we're all living through, and it is affecting every area of your life is being touched by it. So it's on one hand, you're sitting there, you're trying to be safe, you're scared to get it, you're scared for your loved ones to get it, God forbid you have it, you're scared to spread it, it's all these different things, but then it's the other factors, the mental component of it. I mean, I just in the past week, the amount of information that's coming out now with this, the way people are their mental health is greatly being affected, during this time, and then that's coupled with, economic factors and the climate. I mean, there's so many different things and fears that people are having. And I think it's so important to partake in all these programs. And, like I said, Project Independence offers them, but on top of that, our different partners in the community, everyone's trying to really have these virtual things, because I think, I know for myself, if I hear someone else, has similar fears to me and we could kind of all just like talk it out, you feel better afterwards. It's like this kind of giant, support group of people. And I think that that's so important for people that can, especially, can't get out and now it's just, the fear gets reawakened very quickly. It's like you feel like you have kind of a downtime and then you get this, you'll hear something on the news and it gets you all worked up again. So I think it's so important for people, and I encourage, whatever you feel most comfortable in, joining any of these programs. And even if it's just a social program, not everything has to be so heavy. In Project Independence, we have a social discussion group, a world events group, so they're not just talking about that, but it's just creating an environment of support and for you to be able to kind of voice your feelings, which I think is so important.
I don't want to beat this to death, but every time we talk, you realize that the need to have virtual capability
I know
is almost critical, because if you're in a house without any virtual
I couldn't imagine
communication, and maybe you're in an abuse situation to
right.
top it all off, you're basically stuck with what, you're there, you're stuck. And the need to learn this technology and get to be capable of doing even the raw basics it's not an option anymore. It's really required in this day and age, particularly with COVID, to have some degree of a decent life. And like when we talked about reporting abuse and whatnot, if you had the capabilities of virtual learning and meetings and even being able to knock off an email to somebody, it would make a huge difference.
You're so right.
And
Absolutely.
you can only keep encouraging people to try to learn what they can, which Project Independence would help them do. Um, I think it's a must, in my opinion.
No, you're so, you're, I mean, hit the nail. I think about it. And I mean, look how we're in this, for the long haul. We don't know necessarily things. And, it's just, and that's what I always try to stress to seniors who are hesitant about, technology. I'm like, there are so many different aspects that can really make things better for you. Obviously you get this social component. You can talk to people. You could order food online. You could, if you have an app, it's like there's so many different things in your life that on top of it can actually make you feel safer, so you don't have to run out to the supermarket or what. I mean, there's all these different things. And
Your
I
doctor.
yeah, well, that's, I mean, look at these virtual, I mean, how many during the pandemic, you had to do these virtual kind of visits and stuff. So it's, I get it. It's scary for people, especially to dive in, but, I think dipping your toe in the water in one area that you're interested in, and then get kind of used to it. And we had on a
I
couple of
see,
weeks. Go ahead.
Christina, I see that if you call 311, they'll actually walk you through a Zoom, like how to do
Yes.
the Zoom.
So that's so we have, we always promote Barbara Melman, who is our, our technology guru within our Project Independence program. She's the one who does all the technology for the Terrified classes. And she will also help you, walk you through on the phone, the Zoom process. So how to do it, and I, once people do it, I think it's like, it's like when people are nervous to come on the radio show and we're like, we swear, we like, don't bite, you just come on, it's going to fly by, don't worry. And then that's the feeling they have afterwards. Like, oh, that was like, nothing. And I feel like, especially with the Zoom platform, it's super user friendly. And the fact that, you don't have to be, a crazy wizard and hosting your own things if you're not ready. But if you, have an email address and we're able to send you a link, or if you don't even, even if you're scared of this whole world, you can use your phone to, at least connect and get information and feel somewhat part of a discussion. So Barbara Melman, like I said, will walk you through that. You would just call 311 or 869-6311 and we'd be able to connect you. So you could definitely get in touch.
One other one that we had on a couple
Well,
of
that's
weeks
what I wanted.
back,
I have that hotline, the Oat Center, the
yeah,
Senior Planet.
Senior Planet, who would guide you through
Yeah,
based
and
on
they
your
are
needs, what you should
exactly,
buy. And
and
they don't
that's
have a computer.
right, and that's their whole. We're hopefully going to do some work with them. We had a meeting, with our team and Thomas Camber, who is actually the head of the organization, and because they're doing really great things. And he said for North Hempstead seniors, they can absolutely call the hotline. It's 9 a.m. to 5 p.m. Monday through Friday, and it's 920-666-1959. So that's the hotline number for Senior Planet, and you can just call. I mean, how many people have something on their phone? They're like, I can't figure it out, or what's this button? So you can call, and what's great about them is that they are really knowledgeable on a lot of different forms of, whatever device you might have. So I really, really recommend that. And it was exciting. And that's another great thing that came out of the radio show.
Is that a hotline, Christina, or
Yes.
do you have to be a member?
Nope, that's a hotline.
Oh, okay.
You
Okay.
don't have to be a member. And also you can become a member.
Right. I knew that. Okay.
But anybody can call that, because I had asked them that question too. You can just call and ask your question. So, and they will assist you. So that is great. And it's another great thing that came out of the radio program, that we found another organization out there that's providing really, really wonderful services. And John, you had touched upon earlier in your conversation with Supervisor Bosworth about our virtual exercise classes. And
Right.
what was very exciting is what we just had I guess 2 weeks ago, it was our first one, was Margaret, who is our Zumba guru and our fitness guru, actually provided, the first time we've done this, which it worked out very nicely, was a virtual live exercise class. So a lot of our exercise programs originally when we started have been pre-recorded and then they're aired on, North Hempstead TV or on the website or whatever. But this one with Margaret was actually live. So you can sit there and it's, a little more interactive because you're doing it, in real time via Zoom. So it's really exciting. In that class, the registrations have been pouring in. It is
You have me confused.
yes.
People are in the audience?
It's via Zoom. So
Oh,
you're
it's still a
actually
Zoom thing. Okay.
yeah, they're all Zoom. But previously all of our exercise classes were pre-recorded and put on North Hempstead TV. So if you're flipping through the channel, you'd see it. Oh, I'm going to exercise now or whatnot. But this is actually, you can actually do it and see other people working out and whatnot. So creates more of a class kind of feel. So
Okay.
call 311 or 869-6311 for that.
We are in the middle of the Kristina Lou show. One thing we did touch base on briefly in the beginning of the show, and then obviously we talked about other stuff. We just touched on Thanksgiving for a second, but the numbers are becoming staggering again. I mean, it's 1,200 dead just today and 140,000 cases. We haven't had 140,000 cases in a day ever. And I'm not sure about the 1,200 deaths, unfortunately. I mean, it's a staggering number, but like we're going to run the risk now again of hospitals filling up to capacity because everybody got a little complacent and you weren't putting extra rooms on. Not getting political, but I really don't understand why nobody from the White House had said a word in a week about it. I mean, it's really horrendous. And yet it hasn't even been acknowledged. And then we have Thanksgiving, we have Hanukkah, we have Christmas, we have all the they're major holidays. The winter holidays, and you're confined to your house to boot. Because we've talked about outside eating with tents, but we're closing all the sides. And yes, then as Kristina had said last week, two of the sides are open, then you have to have heaters. It just becomes
like being inside.
Almost. So therefore, like Otto was saying last week, you almost got to come down to you and your wife will have, at this point, my wife canceled it. We were going to have a brunch at my daughter's house with a big piece of property, and she has a big kitchen so you could go in and out and not really be on top of each other. And yesterday she sent an email to everybody and she said, I'm not doing it. I'm not coming. Daddy's not coming. We'll have next year. That stay with your families and be safe because, this week alone, I know 3 new people who have been tested positive. And one that works with my son-in-law. And it just, it's happening and you don't need it.
What's your opinion? You said testing. There's a big push on, and none of us here are qualified to tell people what to do, but we can talk about it and have an opinion.
Yeah.
There seems to be a lot more places now where you can go for a test. And like we had talked with one of my daughters, what we would do is the day before, everybody has to go for a rapid COVID test.
Right.
And blah, blah. But that's not always accurate from what I understand. But there are a lot of places now where you can get a test. Have you gone for COVID tests at all?
I have
not.
5 or 6 of them.
You have.
Because when I go into the city, when I go to Sloan, they do a COVID test. So I'm just getting them as a matter of fact. I've been fine every time, but they just do it as a matter of course. And they started that like maybe only 2 months ago, though, 3 months ago. But I'm not going for the sake of going.
Right.
But even those tests you're talking about, Otto, I think if you had 10 people take a test and you wanted to get together and the results were everybody was negative, I'd be comfortable enough. Yeah, there's going to be a mistake in anything.
I think they're actually gotten better. Like, I was actually reading about the rapid tests because I see a lot of places, and it's very complicated matter, this whole testing thing, because depending on what test you get, is certain are covered by insurance. With this rapid test, I want to make clear, unfortunately, not everyone's insurance covers the rapid testing. So you have to pay out of pocket for it. So it gets very complicated, like I said, because there's a lot of, it's the inconsistencies is what drives me, you know, crazy a lot of times. So I think it's important to kind of do your research and look on, you know, legit websites and whatnot about where to go for these testing and what's best for you, you know, in these situations.
The other thing, which is important, Otto and Kristina both, is I'm in a confused situation because I don't feel good all the time. So it doesn't have to be COVID. You know,
Right.
my bones hurt. I feel like I have a fever right now. I feel like I have a fever. But if you're going for the COVID test and you're 100% fine and it comes back negative, I believe it.
Yeah.
But if you're going for the COVID test and you have 102 fever, I'd err on the fact that maybe you do
And
have.
you shouldn't be, regardless, around people. You know what I mean? Like, for you know, taking COVID out of the picture. You know, if you have 102 temperature,
Right, well, I agree.
like,
Right, that's
you know,
true
but
too.
no, but that's what I would say to people. Like, you know, it's COVID's not the only illness out there. You know, so if someone had a cold or the flu, frankly, I'm not trying to spend time with you, you know, in close quarters. And, you know, that's why I always laugh with my husband, because that was always Jay's rule. Like, if your kid is sneezing and coughing, don't bring him to our house. You know, like, so like that's kind of just always
Right,
been
that's true. That's true.
the rule of thumb, you know. And I think, you know, what you're saying, I think a lot of times I haven't really heard about, and like I said, I'm not a professional, I'm just speaking from personal experience. You know, a lot of people, if you're coming up negative, you know, and you feel okay, I think it's pretty solid you're okay.
Right,
Like
I'm
I said,
agreeing.
but talk to your doctor. None of us are medical professionals, obviously. I don't want to preach which test we think is the best or what
We
to
don't
do.
want somebody going to a party and say, but Kristina told me I could come.
Absolutely not. Do not, you know, don't even, because I think it's something you really need to check with your doctor about. And frankly, some people are more comfortable getting multiple ones, you know, to you know, it's like taking 2 pregnancy tests, you know, frankly. And so it's you got to do what works best for you and really talk to your doctor and your family and kind of work out, you know, whatever the best situation will be. Because
I wonder, does Medicare cover COVID tests?
they definitely, I know, like, I would assume I don't know the legit, I could find that out for the next show actually, but you know, you can get a free test, you know, out here. Unfortunately, a lot of those are the ones that have a long waiting time, you know, so you'll take a test and then you're waiting 7 or so days, and it's you know, that's the only thing that really upsets me about this time is this testing stuff. Because God forbid you are, you know, and I understand they say, you know, you quarantine yourself, but that's really not feasible for a lot of people who need to work or whatnot. You know, I'm very fortunate I can work remotely, and God forbid if that ever was a situation for me, I would be able to do that, you know, but a lot of people don't have that luxury. You know, whether you're essential workers or whatnot. You know, I let my husband, you know, he's been working this whole time, you know, and he was like off for like, you know, working remotely for a week, but he does the grounds of all these school districts. So that's not something that they say, you know, like, all right, you know, work from home. So there are certain things that, and you have to think about that too. It's very complicated. And that's what I think makes this situation so difficult, you know. And like I said, I definitely had my moments this week when I was like, life is getting a little hard and I'm, you know, it's getting a little overwhelming right now. And I had like a bit of a breakdown, you know, I got my cry out, had to, you know, re-up and come back in, because it's definitely, it's hard.
You get Matthew McConaughey involved in it?
I did. I threw on my my positive Matthew McConaughey. I actually threw on Bravo Network and watched a little reality TV, you know,
Oh, come on.
which will get your brain right, you know, out of you know, any kind of thoughts. But it's hard. You know, I was talking to my husband about this, and, you know, because like I said, I'm always thinking about seniors because that's who I work with. And, you know, as painful as these situations can be for, you know, a younger, more able-bodied person, I think of the senior who's just been home this whole time, you know, and just the effects. I mean, we on a normal basis prior to COVID had, you know, used to worry about that. And it would be these winter blues, you know, topics we would have, and we had them on the radio show. We've had, you know, different PI programming, because just in general, it's a time that people, you know, it's harder. You know, the weather's changing, it's darker, you're more isolated in general, and then throw on a pandemic. And it's just, you know, like the perfect storm of, you know, depression, frankly.
That's 8 months.
Yeah. You know, and it's 8 months in the cold, you know, like where you can't, you know, at least in previous, you know, you could walk outside, even if you're not doing laps around the block, you can walk, on your front yard and do that. So I just think it's so incredibly important, and I can't stress enough. I wish I had a magical answer where I can go visit everyone's, house and, spread sunshine to their day. But I think as a family member, as a friend, as a neighbor, just keep your eye out for that person that seems to have been alone.
Kristina, while you're talking,
Yeah.
Dan just sent a text. He is staying within his family pod. Testing. Ha.
That's right. I like that. There you go. So
He's not getting involved. But he's right. I mean,
that's what I'm doing. Frankly,
take the chance. It's not worth it.
That's exactly what we're doing this Thanksgiving, and it's just going to be our immediate household, and that's it. And we were trying to think of things with, like I said, with my husband's family, but they're a big family with a lot of children, and now forget it. I mean, they're way over. The Lou family pushes it way over the 10-person mark. So unfortunately this year that's not going to be able to be a thing, but it's hard, and I wish I had, and I'm going to keep trying as we live to holidays, think of different ways, and it's mostly going to probably be a virtual thing, or dropping off things to someone's house or whatnot to kind of do that. I like what you had said last week, John, about one of the things your family was thinking about was like dropping off dishes to each
that was my son-in-law.
and then eating it all together, because it's like, I think that's always the saddest too. Is I know about myself. I mean, I'm so tradition based, and on Thanksgiving, it's I look forward to my mom makes my grandma's stuffing, and that's just like the tradition. So I couldn't imagine a Thanksgiving not having that stuffing. So it's these little things, and I think the way maybe it is to drop it off to each person's house, so you have a little taste of home, even, and family, or friends or whatever it is, and to do that. So we got to get creative, guys.
That's what he said. It's just you see everybody, even if you just put it on the stoop.
Yeah.
Back in your car, you beep the horn, you wave, and you go. And
that's what I always.
You have to cook.
I say too. It's little things go a long way. Obviously, you could sit here all day and focus on being upset that it's not, but I think there comes a point too that you got to adapt to the situation, remain safe. And unfortunately, at a lot of times, the people who are home alone are the ones that are most vulnerable, so you have to think about that too. So we have to just kind of think outside the box a little bit, and get crafty. I'm going to keep looking online, because I'm hoping that as the holidays come closer, there'll be different kind of tips or whatnot of things you can do to make it a little easier. No one's saying we could erase it all, but just to make it a little easier for people. So
bottom line is going to be different, very different. Like traditionally in my end of the world, Bunny would make the turkey, and every other year one daughter has it, and then the other daughter has it the next year.
Otto has his turkey box,
and I have the turkey box. Right, she makes the turkey. It's put in the box, which is wrapped up with tin foil and blankets and the whole routine that goes along with it. And the turkey stays nice and warm and moist. And we bring the turkey to whatever house it is. Well, we're not doing that this year. We're going to one of the daughters' house with 2 people. There'll be 4 of us, period, as opposed to the normal 15 to 20. And is it difficult? Yeah, it is difficult, because I am also a creature of tradition. I like tradition, and Thanksgiving happens to be one of the ones that I like the most, because there's less fanfare involved.
What tradition is in everybody's house is what they want it to be. It can be pressure if you like it, and you're right. You don't have to do anything. You can make your own tradition. But Otto, you have a tradition, and I forgot about that when we first met. I heard about your turkey box. Go ahead now.
Well, over the years prior to this, when my mother was alive and well, she used to make the turkey and then bring it to people at my house usually. And the turkey is made, and 20 whatever pound turkey, and it goes in a big box which has a mark on it, turkey box. I actually have it in the garage, saved for the turkey. And the box has blankets in it and tin foil, and you put the turkey in there and wrap it all up, and it can sit there for hours. And then you bring it to the house, which was in this case now one of my daughters, and the turkey's ready to roll. It's nice and moist. It's hot. It's great. And I like Thanksgiving for A couple of reasons really, but one is it's a simple holiday in some respects than Christmas, let's say. You know, Christmas, especially when you had little kids and whatnot, it was like an ongoing journey. You know, it went on forever. You know, between shopping and Christmas cards and this and that, and you know, and when especially when you were working, you know, you had to run out and shop at night and do this and do that. Whereas Thanksgiving is a little bit different. Somebody makes the turkey, somebody makes the sweet potatoes, somebody makes the stuffing, and it's more of a it's a I can't explain the feeling.
It's a simpler feeling because I
It's a
feel the same
simple
exact way.
holiday
Yeah.
where people are thankful for
Right.
what they're involved with, and you know, I'm not against Christmas, but Christmas is more chaotic.
Totally. I'm with you. I feel the same
and-
exact way. And listen, I'm like, clearly,
Now Christmas starts now on television in August.
which upsets me. And I'm
Well,
glad you're
July, you can watch Hallmark Christmas movies.
I said, I love Christmas. Like I said, I love to decorate for Christmas. I love all things Christmas. However, I don't like skipping over holidays. And this is always where I don't like is that it goes from Halloween and people just blow right past Thanksgiving. And all of a sudden it's like Christmas in the stores. And I said, I feel like we could enjoy Thanksgiving. And I mean, you know what is, I think I like the message of Thanksgiving in itself because it is a time that everyone, you're supposed to sit there and kind of reflect on what you're thankful for, and that's something that I always loved, even as a child, because I think it's a time you actually have to sit back and really think, you look around and say, these are the things that, I mean, everything is count your blessings and so I love that whole, the whole message behind being with your family and doing that. So I feel the same way as you, Otto, in this situation. And I think, like I said, it's different and it's very easy. And I'm saying I've done it, where you have those moments and you'll get kind of bogged down and upset and, think about, oh, well, I don't get to do this. I don't get to see this person. And it's hard. And I think, roll with those moments, but you also have to move on and accept and kind of figure out a way to still be thankful, especially for your health, during this time. So,
well, in the Thanksgiving mode, I think what I've heard a number of people over the years say, you should count your blessings and not what you don't have.
yep.
Count what you do have.
Yeah.
There's always stuff you don't have. That's a
course.
fact, but you got stuff too. So count them as big blessings. Not everybody has them. The fact that we're here doing what we're doing.
Absolutely. No,
it's
you're 100%
a
correct.
blessing.
And I think that's important, and even if it's something like that, and just reaching out to your family and, like I said, doing some kind of virtual thing and everyone saying what they're thankful for, and sharing these things. And Otto, I really hope at the advisory committee meeting you whip out that turkey box and show the rest of these PI seniors. I mean, Otto, maybe that's what you should do during this time is market that, and into a product, because I'm very impressed. Because that's always the thing. When you're traveling, when my grandfather was still alive, we would always go to his house and we would schlep all the stuff over there because it was just easier to cook in our own house and then bring it, over there. But that was always, the hard thing is keeping things warm, and of temperature. And I think you frankly mastered it. So this pandemic might be a marketing opportunity for Otto,
Well, that concept goes along with string beans with
yes,
onions in them or whatever.
absolutely.
You put them in a Corningware thing, wrap the rubber band around so the top doesn't come off, and then wrap blankets around it. Put that in another box, and they do.
I think Otto needs to be on the Food Network channel, John. I mean, I feel like he's missing his calling. He needs like a little Food Network special. I could see my Barbara upstairs, my mom watching that. I mean, I feel like she would absolutely love that. And I just got a text from Paula Ewell, who is the deputy commissioner of our department, saying that I would buy Otto's turkey box.
I love it.
You have your first customer, Otto.
You know what?
Dan wants the green bean box.
Yes.
We got 2 things sold.
That's
We
right.
could make it with like a contour of the turkey in the box.
See, there we go. And I feel like we could have a whole thing on a whole line of different things.
We could have different size boxes, a 12-pound turkey, 18-pound turkey.
I think, John, he's thought about this, you know.
Oh,
knowing
he's been thinking about it.
knowing Otto, we
I
definitely.
think he's been talking to Dan about getting his own show even. I don't want to go there, but I think so.
I love it. But see,
I'm
these are
happy
the
on your show, trust me.
That's right. But, you know, and I think that's important. And I'm sure in Otto's family, you know, the turkey box is, you know, the tradition, and that's things that, you know, you talk about. So I think it's nice to, like I said, everyone has different memories from Thanksgivings of the past. You know, John and I did a special for North Hempstead TV that will be coming out
I
soon.
saw it.
Oh, was it on already?
Yes, I did.
Oh, I have to catch the thing. I have to watch it now myself.
No, wait a minute. No, what I saw was there's a new thing that you guys are doing with Judy. It was a veterans show.
Oh, the veteran special. Oh, yes. Gotcha.
Right, right. Al
But we-
Piscatelli, who I know was on there, and a lot
Yeah,
of.
no, but what we did though is a Thanksgiving special where we talked to all of the, you know, council people and the supervisor, and we'd really discussed. They all talked about different memories and things that they have, or, you know, whether it was a food dish or something, you know, that you know the family always did on Thanksgiving, and it was nice to hear. And you know, I'm saying, you know, John and I really enjoyed the conversation. So I'm saying something as simple as that, and talking to people, you know, and sharing your family traditions, I think is a nice thing that we kind of should do to, you know, this holiday season with everyone.
You know, what's interesting about that is that I have a friend of mine who would all of a sudden come up with a question if you had a group sitting around the table. And that would be one as an example, you know, your Thanksgiving experiences. Another one he asked once that was very interesting. What are you most afraid of in your life?
Mm-hmm.
And have a bunch of people sit around
Yeah.
and answer these kinds of questions.
Yeah, I do these questions all the time
Yeah.
because I constantly have some kind of bizarre question that will pop in my head anytime I have friends or family over, you know. And it's just, you know, it's like an icebreaker, and you start things and it leads, you know, different things. And the fact that you can do that clearly virtually, you know, is a great kind of program to do.
Well, one of my favorites is, how do you put toilet paper, over or under?
I feel like me and Otto actually have had this conversation before.
Yeah, we have. And that always leads to a long discussion.
It's true, see, and because it just sparks your memory, you know, of things. It leads to all different things, because that's
What's
certainly
the answer?
I put it
Kristina?
over. So mine
Otto?
Over.
over. We're overs. What about you, John? John,
Over.
probably over. Oh, you're see?
No,
Well,
over.
Bunny is
My
into-
mother was over.
Well,
All my
Bunny's,
3 girls are under.
yeah, Bunny's into under. So we compromise, all right? We have a bathroom downstairs and upstairs. Upstairs is over, downstairs is under.
Oh, and we got the director Dan Cox buzzed in with he's also an over. So
Okay.
He's
clearly
an over.
the WCWP family all goes over with the toilet paper. So
Well, to the National Toilet Paper Association of the world, that's the over is the official way to do it.
see, we always do things by the books, guys, the right way. All you listeners out there. But I have to laugh because I'm pretty sure too, I don't think Jay even thinks about which way it is and just throws it on, and wherever the dice falls, it falls. So I don't even think there's too much thought that goes into that. But
Well, if you go to hotels, which I used to travel a lot with,
see, that's right.
I would survey to find out, you know, and you have to fold it nice and neat in the front, of course, you know.
Right.
Well, you also buzzed in just now with she's also an over. So
Who is?
over Paula at work. She's listening. She's also over. So that's it. So but see what we're doing here though. Like just now, we talked about this. We shared some laughs. We shared stories, and it's something as simple as that everyone can do in a virtual kind of component. You know, with friends and family, and even with strangers. You know, people that you might not. You know, acquaintances. So you don't have to. You know, I think about that in the advisory committees. Not everyone knows each other super well, but you know, you get comfortable and everyone starts laughing, and that's what I hope our November 18th.
You know, you're bringing back memory. I used to do a lot of entertaining with customers a long time ago, and I would always bring stuff like this up. We would talk about it, and it would break the ice, really.
Yeah,
All of a sudden,
absolutely.
everybody's talking about how to use toilet paper.
Yeah, and it makes you laugh, and it's funny. And this is another reason why I'm always convinced that me and Otto are like kindred spirits. You know what I mean? But it's definitely something like that, and I'm glad that we, could bring this up to people and see how easy it is. Like I said, Otto just rolled off his thought. We were talking about turkey boxes, then we went into toilet paper. So it's something as easy as that that I encourage people to do, and to not be afraid of the technology realm, and to call 311 or 869-6311 to really get connected, and and take baby steps. If you're too scared to be part of the whole technology world, take a baby step into clicking on a Zoom link. That's really all you need to do. So,
and it's important. I agree with you, Kristina.
There's another,
Especially, we're going to be for another X number of months.
Yeah.
I think 6 more months. I'm taking a guess, because the vaccine won't even be available for 2 months, from what I read. And then you need millions, not 100,000. You forget. I mean, it's 100,000 people a day. So you need, just for this country alone, you need 200. No, you need 300 million shots. I don't know at what point they don't think a child needs it. Maybe around the world you need billions. But that's it. We've had another wonderful Kristina Lu show. I want to thank Kristina always for bringing such tremendous guests on. It's really fun. And I want everybody to have a wonderful, safe weekend. You've been listening to Senior Talk Radio here on 88.1 FM and WCWP.org. And next week, the week before Thanksgiving, we'll give each one of our favorite Thanksgiving recipes during the Kristina Lu show.
Ooh, I like
have a wonderful week, everybody.